I can say that our system has changed in 1988 when we rewrote our constitution. So at this moment, they established a new system especially for the public system. So at this moment, they created what we call SUS, S-U-S, perhaps something that you have heard about. That means unique health system. That means this system is unique and for all Brazilians in our country. So everybody in Brazil can be treated by this system, if you are employed or not. Of course, if you are employed, you pay each month to sustain the system. But if you are not employed, you can still use this system. So this is the public. This is for 100% of the Brazilians. Okay. Later on, we start to have the insurances, the private insurances. I think this is something that has happened in many other countries in the world. So they discovered a new way to get money. That means to get money in medicine, explore medicine. So these companies start to sell us insurances, so we can have now another system. So you have to pay for it. So it's expensive, it's not cheap. So it's not for everybody in our population. So on a point, I do not remember when it started, but it was later 1988, we have now two systems, the public and the private. Okay? We have so many insurances, many companies that you can choose, and then you can have this kind of system. What are the differences between both of them? The quality of the assistance is different. Of course, in private it's better than in public because we are in a poor country. So the population is very big and we don't have money enough to support a very good health system for the public. You do not have many resources, you have to wait for to have a consultation, to see a doctor, and if you have a problem, you may have to go to a hospital, and all these hospitals are all the time busy. So the main difference now is this. In the public, you do not have many resources, you have to wait for to have a consultation, to see a doctor, and if you have a problem, you may have to go to a hospital, and all these hospitals are all the time busy. And on the contrary, for the private, in general, we have more resources, we have more hospitals, so you can have consultations, waiting lists is shorter than in the public. Even for a person who has a private insurance, there are differences between companies, and the amount of money you pay. You may have differences in the treatment you get. So there are not good insurances that are close or very similar to the public system, but there are others that are very good.
In my opinion, the greatest difference between the public and the health system is the money. The private system, you have money enough to afford the things you need to do. If you need to do a surgery or if you need to do some exams, it'll be easier because they already have money enough. When you talk about the public health system, in general, they have a lot of money, probably much more than private health system, but they have to share this money with 200 millions of people. So at the end, you have nothing. So as they are doing right now in America, you have the insurance plan for rich people and for poor people. And this plan for poor people, you pay less, but you don't have everything you need. So if you need something more complex, you have to pay it. It's like if you need primary health care, probably gonna find easily in this kind of insurance plan. But if you need to do some transplant or something bigger than this, you have to pay. And another reason why people have to spend money outside the health system for pay for the treatment is the lines. Sometimes you have to wait for in a line for have a RMI or kind of exam. So if you go outside the public health system and you pay for it, you're gonna have your exam earlier. So you help your treatment process. It's really hard to say if the quality is the same. What I can say is the doctors, it's pretty the same. You have a joke between doctors in Brazil, it's everyone's gonna work for the public and for the private system during their life. So the problem is the doctors are the same, but when you are trying to treat someone and you are asking for money to the health system, asking for money to the private health system is really easier than you ask for money to the public health. So you have more technologies, you have more exams, the surgeries can be more complex. So yes, the professionals, the doctors are pretty the same, but the technology is different. The private system have a better technology.
We have this agency who is responsible for taking care of our system, especially for the private system. So this system tells to the private systems, you cannot have waiting lists. So they used to say, okay, to see a generalist, the patient can wait just 1 week, the maximum. Okay, so all the insurers, they have to work with this rule. Okay, but in the public system, we do not have this kind of rule, and because they are all the time busy. If you are unemployed, you can still be treated in the public hospital. If you have never paid for it, you can still be treated in the public system. But the question is also if the healthcare they require or they need or they deserve. You understand the difference? Because everybody deserves the same thing, but they do not get it.
But what's really happening, it's the people who's living near the city center or around the place richer, probably gonna find a treatment. After everything you talked before, of course I prefer the private health system. I use the private, I pay insurance plan, but I hope one day use the public health system as the same quality today you have in the private health system. The public health system, I would be treated there if I have some car crash or trauma accident, because they are prepared for this kind of thing and actually don't have time to go to the private. The doctor is gonna find you and give you the first help every time you be from the public health. They are really prepared for this kind of thing. But if I have to treat some chronic disease as cancer or diabetes, probably I prefer the private health system.
Yeah, I'm a professor in the university, I'm a doctor at the university, I spend a lot of my time at the university and I'm not well paid. And, but I like what I do. I like to have students, I like to teach. And in spite of working in a hospital with not many resources, etc., we have many challenging cases. And so as surgeons, we generally like to do different things, you know. So that's the reason I used to work there.
Because I wanna I want to be like a really specialized doctor. My plan is to spend, after I finish my degree, 8 or 10 years studying and be really qualified. At the end, I don't know if the public health system is going to have space for me. Do you know? Because imagine, because it's like should be 80% of the problems the healthcare can treat in the primary care. So they don't need so much specialized doctors. So I don't know which system is gonna fit me better. But yeah, I could be work. But it's not just my choice. It's the system choice. Or you need many steps, but first is to believe in this health system. They are not working as they could right now, but if the doctors, if the society believe in the system, probably gonna work in a few years. And the second steps is to understand which problem you have right now and which problem you're gonna have in the future. Now we are treating a main infection, kind of disease, and in the future gonna be probably just chronic disease as diabetes and heart disease. So if you are prepared for the changing in the health system, where you should take care, where you should put the money, I think it's a good step for developing the system.